Hello, everyone, and thank you all very much for joining us this evening for the concluding lecture of the Inspiration Lecture Series, Fall 2020. This evening, we have with us Dr. Abhinay Muthoo. Dr. Abhinay Muthoo is a professor of economics in the Department of Economics at the University of Warwick. He is also a fellow of the National Institute of Economics and Social Research. He is a member of the Cross-Parliamentary Party Youth Violence Commission and the director of the Warwick Policy Lab. Dr. Muthoo has previously been the Dean of Warwick in London and the head of the Department of Economics at the University of Warwick. Dr. Muthoo was educated at the London School of Economics and the University of Cambridge. He has broad research interests, and these include game theory, political economy, negotiations, international development, law and economics, and public policy. He has published papers in many top economics journals, and he is the author of Bargaining Theory with Applications, described as a publication that any economist would want to have as a reference. Dr. Muthoo will be talking today on the topic of the economic and social impacts of COVID-19. Before I hand it over to Dr. Muthoo, here is some basic housekeeping rules for everyone. Please remember to keep your mic and webcam turned off at all the time when the lecture is on. Dr. Muthoo will take questions at the end of the lecture, so if you have any question, please feel free to write them in the Q&A box. And with that, I hand it over to Dr. Muthoo. Dr. Muthoo, it's all over to you.
Thank you very much for inviting me and organizing this all. It's a real pleasure to be with you here at Jindal Global Business School. I know that as Chitrakapa mentioned, you've had lots of interesting speakers, and I'm the final one for this year. Thank you for being here today. I know that it's 6:30, I think, in India, so it's early for dinner, I guess, Indian time. But in England, they would have been having dinner time. In England, it's 6:30 dinner time. So what I want to do is I want to speak for only about 35-40 minutes, allowing at least a good 20-25 minutes for us to continue the conversation by you asking questions. I think that really will make this hour that much more productive, that much more fun. The last thing you want is a boring hour of me just talking to you. But let me, as I said, spend half an hour or so, 35 minutes, just setting the scene. It is about COVID. It's funny, someone tell me, is anyone doing anything other than COVID work? They are. Most people are still doing, I'm sure, other work as well. And I want to focus in this hour talking about the impacts that this pandemic has had and across people, across communities, across countries. And I'll show you some slides with some specifics, but I want to just sort of sit back as I was reflecting on this theme. And, you know, had I given this talk 8 months ago, it would have been a slightly different talk, 6 months ago, 3 months ago. And right now, as you know, today is just want to tell you, you may not be aware. Today, this morning at 6:30 UK time, the first vaccine was given to a 90-year-old woman in England. Because some of you might be aware, you may be aware that England, the UK, is the first country, to formally approve the Pfizer's vaccine. It did that a few weeks ago, and the first vaccine was given just a few hours back. So this is quite a historic day to be speaking on this, like a turning point in many ways, of this whole business. I think as we're assessing the impact, you know, one of the things at this point of juncture besides the point I made about it being a turning point, it's not over. We're not over yet, far from it, but it's a turning point for the better. That, you know, the last time the world faced something like this was about 100 years ago, when the Spanish flu raged across the world. And you can Google Spanish. It's called the Spanish flu, not because it has anything to do with Spain. It's called the Spanish flu because it were at that time in 1918, roughly 100 years ago, the Spanish journalists were the journalists who were reporting it across the world big time for various reasons that you can look up yourself. But the Spanish flu 100 years ago, it killed about 50 million people worldwide. Okay, 100 years ago, Spanish flu, a pandemic of this magnitude, kills 50 million people. About 9 months ago, at the beginning of the year, when this pandemic was declared a pandemic by the WHO, it was a virus. The coronavirus was a virus that was a new virus. It was a novel coronavirus. We meaning the world, had no idea how deadly this virus is, how infectious this virus is. So around March time this year, the reason you could think why it was declared a pandemic was because of this huge uncertainty. Okay, and you just put that and putting the Spanish flu in context, you can see the scary prospects. In fact, in the UK, a week later, before the lockdown would force the lockdown, Imperial College of London epidemiologists said if we don't lock down in the UK, about 250,000 people will die very quickly. And the same was happening across the world. That because of the not knowing what this virus is, its deadliness and its infectiousness, across the world in March, April, May, around that period, the whole world, almost all the world was in lockdown. That's the action that almost every government on this planet, every country took, is to impose some form of lockdown. There are exceptions, 1 or 2 exceptions. And that was the immediate impact of the virus, if you like. And we will talk about the impact of this COVID-19 is firstly, of course, directly on the populations, on human beings, with deaths, falling ill, and so on, but also the indirect effects of COVID through government action on people's livelihoods. And therefore, when we are assessing the impacts of COVID-19, the economic, the social impacts, you're looking at the direct effects of the virus and of course, the lot of the impacts that we're going to talk about are the indirect impacts of COVID caused by government action, which one can debate was necessary and so on. That's a different issue, but the actions. Before I dive into looking at those kind of specific impacts on people's livelihoods and so on, I want to sit back and just, as I have my first slide up, want to mention a couple of points as you are reflecting on this. And we are, the whole world is trying to work out, what's it going to be going forward, okay? Although we're still in the middle of this pandemic. And by the way, it will take another year before the vaccines are out there, to vaccinate, we're not going to vaccinate. The world's population is about 8 billion. We're not planning to vaccinate, I doubt it, every single 8 million person, but most need to be vaccinated. And that'll take a year, 2 years. And I read a piece the other day which saying that, okay, we'll get back to some normalcy in the next year. But the disruption is here for next few years. Okay, so bear that in mind, that point, the impact of this. Again, put the context of the Spanish flu, it took 2-3 years, I think, before the pandemic was declared over. And I think the WHO Director General announced, I think a few months back, that he thinks that he will be able to declare the pandemic over also by the end of 2022. Okay? So while we are gradually turning a corner and gradually we can see the light at the end of the tunnel is still long. And of course, there's variation. This is an important point. There's variation across the world. And within a country, across people, right? Rich people have had less impact than the poorer people. Okay, that's an obvious statement to make. So it's not as if that everyone has had the same impact. Uh, people have had different kinds of impact depending upon their situation. What is key is that this is a common shock. So everyone has been impacted in some way. Yeah, even the rich person, by the fact that they're in lockdown, when they were in lockdown, their lives are impacted. Businesses are impacted. The second point I want to make about the big impact, about the overall kind of direction that I want you to think about, if you're thinking about this stuff, which I think everyone should be thinking about, whatever your specialty is the following point. One of the things that was happening pre-COVID is that we were going through, we meaning the world, through a technological revolution. Okay, we all know that for the last 10, 12 years, we're going through a technological revolution, and it's moved into what you might call an AI revolution. Okay, so when I'm thinking about technological revolution in this century, I'm thinking about the AI, the artificial intelligence revolution on everything, from businesses, how we work, how we live, how we do politics, you name it. Okay, so the disruption that the AI revolution has started before COVID. One of the things that I would say overall impact of COVID this year has been is that it is going to accelerate change. There's a famous term called creative destruction, a term that was coined by Joseph Schumpeter in the 1920s, 30s, where he talked about how technological forces can destroy things that are not fit for purpose and create new things that are fit for purpose. And the digital revolution that I mentioned had already unleashed the forces of creative destruction. And what the pandemic has done has accelerated the change, the speed at which those forces of creative destruction are going to disrupt stuff left, right, and center. Of course, a lot of people are talking about, well, hang on, when we go back to the normal, we'll go back to our old ways. That's not going to happen. Change is going to happen. What no one knows, by the way, no one, and I mean no one, knows is in different walks of life, how much of a change will happen. So for example, everyone right now is working from home. You've been studying, students, you've been studying from home. The question is, will that stay always? No, it won't. But there might be a blended model, right? A blended model where lectures are given online and you meet in face-to-face for tutorials, for discussion, for conversation, for asking hard questions to your lecturers, which you should anyway. That will happen face-to-face. Universities will have to adapt, and that change has been accelerated. So all such small things will happen overall. So one big overall impact is going to be the acceleration of the forces of creative destruction that had been before the pandemic due to the technological revolution. The second thing, which wasn't there pre-COVID, that COVID has created, and you can see it probably in India as well, but it's across the world, is that the state, i.e. the government, has got bigger. Okay? So the other huge impact, which wasn't there before COVID, unlike the technological stuff I talked about, is that the state, by the state, I mean the government, has got bigger. And we're going to talk a bit about that in a minute. They have become bigger in this last 1 year. And I think that one impact overall, which is going to affect everyone, from people to businesses, as consumers, as firms, and so on, is that the state is going to have a bigger role to play. And there can be good from that, and there can be bad stuff coming out of that as well. So just bear that in mind. So before I move on to some specifics, and in fact, that segues me into the government interventions, let me just also say something up front to all of you, that I don't have any answers, by the way, and I apologize for that. But I think no one else on this planet has answers either as to what will the world look like in a year or two from now, in terms of impacts. Obviously, I know we know something, and I was just trying to make my point to effect to invite you, especially the students, but even faculty, start thinking hard about what uh, what um, what the world might look like. So in that sense, I meant we don't really know the answers. This is a new thing. Everyone's facing this first time. But one of the things I made the point about the impact of COVID on governments increasing their size. Let me just quickly run through. Again, I'm keeping track of time. Run through the kind of things that have happened in the last many months since the pandemic was declared. Is that so as we all know that at the beginning of the pandemic, right across the world, I think every country almost, with a few exceptions like Sweden, were under lockdown, including India. I was sitting in London, as I am still, same place, not the same spot for the last 9 months, but basically how the Prime Minister in India announced a lockdown within a matter of hours. And of course, I'm sure you have views on that. And so basically, as a result of that huge government intervention of a lockdown, which is just to put in perspective, because human beings don't necessarily listen to keep distance. It's called social distancing. Don't necessarily listen. Not most people do. That governments have to impose force people to do it, and that's what a lockdown is. A lockdown is saying that it's illegal to be outside except for certain reasons like getting essentials, food, medical, and stuff like that. But of course, what that lockdown implied, the huge impact, the immediate impact of a lockdown is that you're basically shutting down economic activity. Okay, so all economic activity is shut down by design, okay, by governments. Social activity is shut down as well. So, but let me just focus on the economic activity. But if economic activity is shut down, lots of people, especially, take India, for example, all the migrant workers in the millions, in the hundreds of millions, I think, I don't know the exact number, but definitely millions, don't have income to feed themselves because they're typically earning income on a daily basis or a weekly basis. And of course, this, by the way, this loss of income wasn't just India and that group of people. It is other people as well. Okay, in the UK, the hospitality sector employs millions. Suddenly, those individuals have no income coming in. So, and of course, slowly in the coming weeks and months across the world, people are losing income, are losing jobs, are facing hardship. So the first thing governments have to do, which they did in different measures, is basically transfer money, cash, transfer food, boost the social safety net. So that's one of the things we witness across the world. Of course, it varied across the world by how much any government can afford. Obviously, the United States could afford the most, it's a large economy compared to Germany, compared to England, and compared to India, and so forth. But of course, it's not just about how much governments can afford; it's how much governments are willing to borrow. And again, those of you who are into this macro business of borrowing, all the rules are going out of the window, right? And just to give you an example, until pre-COVID, each government was very prudent in its finances, in government finances, where to spend and tax. One of the impacts of COVID on government budgets is that, at least in the UK and in many parts of the world, the fiscal rules are basically have been relaxed big time, if not thrown out the window, in order to support people. Because one of the consequences of COVID, one of the indirect consequences of COVID, are people, and you will know this, you will have read about this, that it's not people going to die of the virus, people are going to die of hunger. There was also support in some parts of the world, and you might have comments on how much support there was in India. And I'm sure you have views on that. That's better than I do. Income support for businesses. But the idea was that the idea of the lockdown and the support, lockdown and then support, was basically to put the economy in hibernation. And that was the immediate impact in the first few months. Still is there, is that we're going to put all the economic actors, the employers, the businesses, workers, lenders, and then we're going to sort of, the view was and still is that we can then, by spending money, that's called fiscal policies, basically government spending money through whatever means, and monetary policy, by the way, is basically interest rates. So across the country, across the world, central banks basically kept interest rates low. By keeping interest rates low, it makes it cheaper for people to borrow money to feed themselves. Okay, so basically, governments have these two instruments about spending money and keeping the interest rate down. And the idea there was, you may have heard, there was, the idea at least a few months back. I mean, people are not talking too much about it right now because it seems less likely. Is that we would have a V-shaped economic recovery. All economies have contracted big time, right? All economies across the world have contracted big time, and that's what the downward part of the V is. The upward part of the V is, people still have this view that in some economy it can happen, is that once the economy is opened up, we get economic activity moving fast again, and the impact is less. By the way, in some parts of the world, in the UK, unprecedented. The state basically was, I don't know how many of you read about this, were paying the wages of employees in some mechanism. They were doing all sorts of measures, cheap grants, cheap loans, taxes, lowering interest. We talked about all that, and so on. So my main point here is that across the world, different governments intervened big time by trying to support people because of COVID. They had to closed economic activity. I know India has opened up. Of course, universities are still not on campus yet, and that's the same in the UK has a blended learning. As you're assessing the impacts, I'm going to talk a bit more. We're going to talk move into them in more detail in a minute. Just want to put something in context, is that you want to think about these impacts as you're reflecting on the impacts and you're trying to assess the impacts. You want to ask the question: have there been failures? And this is a question that is being discussed, at least at the beginning, and still is first fact is that different governments responded different. So what is true is that every government, by and large, had the same kind of approach: lockdown, support, spend. Okay, but there was a variation in different governments' responses, and some people argue that some countries didn't spend enough. Okay, or some people didn't close down the economy sooner, or some people opened up too soon. So there's all sorts of debates as to that, but the broad strategies were the same. What's interesting, to make the point in terms of impact, by the way, is that after 100 years, the world faces this kind of shock. Yeah, the World War II and World War I were not this kind of shock. Of course, there were huge shocks, but a different type of shock. And there's a question of whether we were caught by surprise, whether countries were caught by surprise, in terms of not having invested in healthcare, right? In England, I think same happened in India, is that people were, in the UK, we put up new hospitals within a matter of weeks. China did that. Personal protective equipment, there wasn't enough of it. ICU beds, not enough of it. And one of the bits of the first few months of the pandemic was, the impact was, because of that case, it was all about what you must have heard: flatten the curve. Because as you all know, that the COVID was growing exponentially, you need to try to get that down, that exponential curve, as down as possible, below the healthcare capacity of a country. Otherwise, people will die on the streets because there aren't enough ICU beds. That scary scenario. One of the things, again, in terms of, as you're assessing the impact on institutions, we're thinking about the future, right? We're thinking about how to do better next time. Oh, there will be a next time, although Bill Gates was saying the other day that the next time won't be as bad. And I'll tell you why he said that. It's because we will be better prepared. The world will be better prepared. And that is a question, whether the state institutions in different countries were weak in terms of managing this crisis. And again, when we're thinking about the impact of COVID, I want to invite you all to think about also in terms of impact on government institutions, of state institutions, on hospitals. And the reason why you want to assess those impacts, and they will better people will be looking at this over the coming years, is you're looking at them not to blame. It's not a blame game. It's to understand where will the fault lines and what can we do over the next 10 years to address those fault lines so that we are better prepared for the next pandemic, which I hope won't happen for another 100 years, but who knows. Um, Let me spend, of course, I said what else, because I'm sure you got other things to say. Let me spend some moments now in this, which is the main, one of the titles, which is speaking to the title of the talk, about just going through, what were the impacts, economic and social, on of COVID? As I said to you at the beginning, the impacts were all negative, hence costs. Hence why that's why it's called a cost. It's a negative impact, i.e., costs. Of course, the impact was not just the direct impact, which is getting sick and dying, okay, but the huge economic and social impact was created indirectly by things like lockdowns, okay. And I want to spend some time, what sort of just go through a list I wrote down as to what sort of what are the types of impacts it had. We talked a lot about this, that economic activity. We talked a lot about economic activity, was lost, um, and there was a contraction in the GDP of each and every country. Of course, different amounts of differentially. A lot of businesses have gone under. Okay, a lot of businesses have gone under, and some of them which might have been good businesses have gone under. Some of them which might have been bad businesses have gone under. You remember the term creative destruction, a really powerful term, is so relevant now, and especially the impact by their going forward. Just to give you an example, so one of the impacts of pandemic has been there's been more e-commerce, right? By that I mean people are buying more online, right, through Amazon or whatever, right? And the question is, if that there's a view, and you in the business school will know better than I do, that actually that might stay on into the next 10 years. That that in some parts, for some communities, for rich people, or they might do more shopping online, in which case, the business model changes of certain companies, right? High-end clothes maybe should be sold only online. I'm just throwing that as an example. So indeed, one impact is that business has gone under. What's the new business model? So, business school should be thinking about what's the new business model. How do we? I mean, this is a great, this impact of COVID. It brings up huge topics of conversation, of research, of teaching for business schools, because, as I said, how the corporate world, how the business world operates, going forward, will be different in some fundamental ways, both in terms of how we do business, how we sell, how we buy, supply chains, how we work, yeah, how we incentivize people, what people care about, and so on and so forth. That's another big question. But people lost jobs, right? A lot of people have lost jobs. That's been an impact. We talked briefly also about the migrant workers, the gig economy. One of the things about the technological revolution, which is unstoppable, by the way, which is unstoppable, totally unstoppable, is going to create more and more of a gig economy worker. So this is here to stay. And the pandemic has accelerated their plight. Right? They've been the worst affected because they don't have a job that gives them a paycheck at the end of each month. Right? So gig economy workers is typically people setting up their own businesses, small businesses, and basically the pandemic destroyed a lot of those small startups. And the question then is, well, how do you support people? And this is a big question for India, is how do you support people as you want the economy to prosper and grow, and you want startups to happen? How do you support people if such a big shock happens again? And people won't want to go into starting up a startup unless you have some insurance. And I know Professor Bardhan talked about UBI. That's a big topic that's coming back up on the thing. Again, no one has the right answers. If you Google UBI, there's some work out there, but not much, because UBIs are very costly and so on. And so, but it's a topic that needs to be thought through. Mental health. So mental health was a taboo subject even in the UK till about 10 years ago. But one of the things that the WHO is talking a lot about is the impact of the pandemic on people's mental health. Okay, and I don't know how much of it is recognized in India, but this is a big concern, and it has impacts on productivity, etc., etc., etc. That is a huge impact of COVID indirectly via the lockdowns. Even though we are not under lockdown in many parts of the world anymore, the restrictions that are in place will impact on mental health. I worry about young people. One of the things, my biggest worry is the impact on young people who are starting out, who are studying, who are looking for jobs. I mean, the impact on the young people of this pandemic, I think they're being one of the groups of people across the world who have been hardest hit. And I think that governments, the state, universities, organizations need to do much more. Domestic violence, child abuse, right? So this is a big subject in the UK, that as a result of the pandemic, there has been an increase in domestic violence and child. You can already see basically this big question coming up, that there was a debate earlier on. I mean, it's not too much debated about whether the cure, which is lockdowns, is worse than the virus. Um, there's going to be post the lockdowns, in this period, there's going to be huge adversity. I don't think there's going to be a V-shaped recovery. People are talking about W-shaped recovery. Who knows? I think most economists, I'm an optimist. I think we will get out of this. We need to solve the health crises first. We'll get the economy moving, as I said, but it's going to take a lot of time. One of the big questions, by the way, which is, how do you put values on these? How do you measure these costs? What are, by the way, I'll leave for you, what are other sources of the cost? How do you measure these costs, right? What's the measure of mental health, of worsening mental health? And that's the kind of work that I expect to see done over the coming years. Obviously, you always do it retrospectively, although there's a big industry out there of people trying to work out stuff. Have there been any benefits? Of course, the biggest benefit is indeed the saving lives, right? So the benefit of lockdowns, of restrictions, is to stop the spread of the virus and save lives. Okay, and indeed, we're not going to, hopefully, keep fingers crossed, we're not going to approach the Spanish flu death rate of 50 million, but it's still going to be huge. It's going to be huge. But that's been one of the benefits, impacts of the government measure. But there was a piece about how, I don't know whether, for those of you who for those individuals across the world, it's been an opportunity to slow down, to be more creative. I'm trying to find some silver lining in this horrible year that it has been. And one silver lining might be that. I mean, just look at the vaccine technology. Just amazing. Vaccine take years to develop. And of course, this is, by the way, different technology they've used. But it shows how when the human ingenuity, all the scientists across the world are working together. I think there were 25 different labs working on it, that we can come together and produce a vaccine within a year. Again, one of the questions as you think about the impacts, now this is a deep question about how much is a life worth, right? How much is a life worth? And you might say, or you should say, priceless, right? And to any human being, that is the right answer. It's priceless. The problem arises when you put your hat on of an economist, of a government official who has to allocate money, who has to make decisions, that you need to be able to put a price to human life. Because if you take a view that no, each human life is priceless, is worth an infinite amount of rupees, well, in that case, we should just stay in lockdown forever. Just to make my point, right? Until every life is saved. And of course, it's not just this pandemic. Even otherwise, people go out their business, they're on the road. You're taking risks all the time. So it's all about risks, and therefore, in order to assess those risks of going out and this and that, you need to put price. And indeed, there is health economists have different methods. Nothing sacred about these methods of trying to evaluate in a systematic way, how do you put a number, a price to life? And the number, by the way, from just to give you, in case you're thinking about it, I think in the United States, one approach put, I don't know, was it $10 million? Okay, and just throwing a number to you guys out there. So that's in a US context, according to some measure, it was $10 million. I'm sure that in India, you might have a different approach to it and get a different number. But the idea, the key point, you're putting a number to, and that allows a policymaker, allows an economist, a policymaker, a business person to make a decision on whether to do A or B. When do you get people back on campus? The president of a university has to make a decision. When do we allow? And it's about taking risks. And in a way, you are assessing in the back of your mind about, how do you prevent deaths? And these things are relevant. So I have one more slide before I'm gonna stop. It's another 5 minutes or so. I'm just looking at the time. So there will be other, I'm sure, by the, just want to say, I've just given you some of the elements of these the costs, these impacts, economic impacts and social impacts. I'm sure that you are, and you can tell me that in the Q&A session, I'm sure you come up with many other benefit costs, many other impacts, most of them being negative, i.e. costly rather than benefits, but maybe there's other benefits of these indirect measure of COVID, i.e. of lockdown, that you might want to mention. I want to close my bit of the talk by, I will I wouldn't leave the slide. This was a slide about how do you assess it, how do you evaluate the costs and benefits. And that's hard because by the way, one of the evaluations of when you get all the impacts, you want to be able to add it all up and say, what's been the aggregate impact, the total impact, economic and social. And that requires, complicated calculations. So just give you what is Abhinay talking about? Let me just say it this way. So take mental health, right? So if the COVID gives rise to a lockdown, which affects, let's say, Abhinay's mental health. Now the question is, if the impact is only until the lockdown is over, that has a different impact than if it impacts me fundamentally, that I give up my job and I basically have depression for the rest of my life. So basically what I'm trying to point out is that in assessing the impact, one has to look at these differences, and that requires looking at following people, businesses. So by the way, it's not an easy exercise to do in the detail in assessing the impacts, the long-term impacts. You might have a short-term impact and know what it is, but the long-term impact, especially on people, one of the impacts that the World Bank, the United Nations is talking about, Gates is talking about, is, hey, hang on, the impact of COVID indirectly because of lockdowns and because of the turmoil on the world community is that there'll be poverty is going to increase. We were winning the battle against poverty. This pandemic's impact, the poverty is going to increase, and we've lost a generation of work. Okay, now we don't know whether that's true in terms of losing a generation of work, whether we can get back in the next few years, but that's the kind of impact, that's big stuff. At the same time, countries in the richer countries are reducing their support. By the way, we are in a really, at the same time, we are, on the one hand, we're in a really bad, it's been a horrible period, and we've got a difficult period ahead as a world and within countries. At the same time, this is an opportunity, especially for young people, to have an impact. We're dying for new answers, novel answers to how to solve problems. So one impact intellectually is that, in the 1920s, 30s, 40s, 50s, the world was debating, for example, capitalism versus, more socialist approaches to economy. How big should the state be? Those debates were settled in favor of markets, of capitalism, of liberty, and all that. Those debates have been opened up as a result of the pandemic. The debates happening, should governments intervene more? So it's a great opportunity intellectually for young people in particular, but also not so young people. Why not? Even I could try to think about these issues as to what's the right model for how we organize society, how we organize business, what rules should we have? And these are burning questions that's the impact of COVID, if you like. What's going to happen to globalization? My view is that it is going to slow down, but human beings have been globalizing since the beginning of time, right? When Marco Polo went to China to get spaghetti, that's globalization, okay? And so it will slow down over the next 5 years, maybe, but it's going to come back. Human beings like to go out there and find out stuff. The state, yeah, the state's grown, and I doubt that many states will suddenly go back and contract. You know what states are like, what politicians are like. They will maintain their size, and maybe rightly so, to do the good things, to build the public infrastructure around health. But the future of democracy is at stake at the moment in many parts of the world, across the globe. And with technological revolution happening, accelerated by pandemic, when I say how do we organize society, I'm asking these big questions that were asked, before, let's say, World War II, that was sort of settled the last 70 years, that have come back with a vengeance. We're seeing a rise of populism, which has been accelerated to some extent due to the pandemic. At the same time, people are talking about, because of this increase in the size of the state, that 1984, George Orwell's 1984, Big Brother kind of privacy issues. These issues have come to the fore. We don't know how to handle that. We don't know how to handle data, right? We have the big tech companies who are doing stuff. So we are now, in the next 10 years, we'll have to think about how do we decide who owns and how do we regulate these companies. One of the big questions out there, the impact of COVID that was brought to the light, was the fact that although we have the WHO and it tried to coordinate, there wasn't enough cooperation. There wasn't enough coordination of activity. 20 labs operating independently. There wasn't any kind of cooperation, maybe behind the scenes a little bit, maybe with WHO or among scientists themselves. We need to think about how does we strengthen ways through which human beings within countries and across nations can cooperate better and coordinate better in terms of whatever it is that we need to coordinate over. In this case, let's the vaccine, for example, right? We're not out yet out of this horrible crisis. I would like to see more discussion at the world level of how do we get vaccines to the poor people, right? What are the logistics? I know there's a plan I was reading that India is putting out for how to take a decentralized approach, which is the right approach. But getting it to the rural villages, India has, I don't know, 500,000, 500,000 villages. How do you get the vaccines there? And that is a big question that needs addressing. And that's cooperation and coordination within India. There is a moment, one impact of one consequence of COVID is indeed that people are asking, but no one's doing anything about it. Do we need new international institutions? Does the United Nations system need to be reformed? Do we need new order? A bit like, after World War II, there was the Bretton Woods order established, which established kind of, stability for the next, 70 years, something like that. And we are at that moment. That is the impact of this pandemic. This is, by the way, my last sentence here, as I look at time, is that this is a war. This is a war, a world war against the virus, and we never had that since the Spanish flu 100 years ago. So on that note, I want to stop now. I think we'll go about 20 minutes or so, and invite you to ask questions. So, Chitrakalpa, I'm going to stop sharing my slide and come back to give it to you. There we are.
Thank you so much, Dr. Muthoo, for such an insightful discussion. And we have lots of questions coming in. I'll start taking this question um, from Anurag. He has asked a very interesting question, and in the last slide, you have actually touched upon that. Anurag has asked, is COVID-19 the beginning of the end of globalization?
So Anurag, thanks. Great question. As I said, I think the answer is no. However, it will slow down. And the reason I give that is not because globalization happened. People think it happened in the last 20 years. No. Human beings have been globalizing, quote unquote. What is globalization? Globalization is people moving across goods and services across borders. That's been happening since the moment human beings came to be. But it will slow down. So you will see on the slowing down of that. But also, the reason why it can't slow down too much is because of supply chains out there. You can't destroy them, and how are you going to start again? So maybe slowing down. There won't be any people doing new stuff, Anurag. That's what I think anyway. So you may have different views on that. So I'll leave it there.
Thank you. Thank you so much. We have some questions coming from our colleagues. We have two very interesting questions from Dr. Parul Bhandari. I'll see if I can allow her to speak so she can ask you the question.
Sure.
Yeah. So Dr. Parul, you can unmute yourself now. You can ask the question.
Thank you very much, Chitrakalp, and thank you very much, Professor Muthoo. It's really great to hear your talk. I just have two questions. I'm not quite sure if you how they'd pan out, but anyway, here they go. Firstly, could you comment on the impact of the pandemic on the Indian informal economy, given that our country is mainly driven by this sector? I mean, I was recently reading an interview by Professor Jayati Ghoshan, who talks about how the pandemic completely broke the back of the informal economy, worse than when demonetization happened, and she thinks that the agriculture sector too will not be able to recover. So what, according to you, should be the measures taken to ensure that the informal sector can be risk averse in the future? And a related question would be, as we know, in the informal economy, it is mainly women who are more employed than men, partly because they hired for lesser wages and they can work in part-time employment. So what, according to you, do you think could be more gender-focused policies or initiatives to ensure that in the future, women are not more adversely affected or impacted than men in times of these economic hardships?
Great questions, Parul. Great questions. Thanks a lot. I don't have good answers, but I'll attempt. So Jayati Ghosh, I remember her. She was a couple of years ahead of me in Cambridge. When you mentioned that name, I think it's the same one. It's the same. She's the economist, right?
Yes, I think she was at Cambridge. Yeah, yes, exactly.
Yeah, I remember she was a few years ahead of me. So listen, I think that. So first of all, good question, and you're spot on. India has a large informal economy. We all know that, and that will have been, destroyed initially, at least. I don't know whether I haven't seen the data as to what it's looking like, how it's doing the last couple of months or so. But what is clear is that the government economists, the government needs to recognize, I'm sure they are, maybe not to the sufficient extent, recognizing these facts about the informal economy and are responding appropriately. I think, again, it may be in terms of, there may be support, financial support to these, as I mentioned, to same thing in England. What these small businesses want is cash to pay, let's say if they're paying rent, okay? Paying their fixed costs. So that kind of support, can the government afford that? It might be means tested, it might be targeted. It may be support in terms of infrastructure, like getting the migrant workers. So they may be not having enough workers. So identifying the problems that the informal economy is having at this point is important, and therefore targeting the support, government state support, to get them going. Because I think what the state needs to do is recognize they're important part of the economy. You need to support them. So I don't know. You will know more than I do about whether that's happening or not. But I don't. See, by the one thing, I'm a more of an optimist. I think that we're going to get through this. When I say we, I'm talking about across the world and across different communities. The Indian informal economy is here to stay. Oh, that I can give you guaranteed. It's here to prosper. It's a question about time. It's a question of how much destruction happens in the meantime. And that's what we want to minimize. So, by the way, even if the governments do bugger all, the Indian informal sector is here to survive and prosper because of the ingenuity, the entrepreneurialness, if you like, of the Indian person. But again, that might, in the process, you don't want lives to be destroyed. So I think government support is critical. On the women point, I'm very, this is before COVID. It's a big issue, gender empowerment. And here I can tell you what this is something which I haven't really produced much work, but consumed a lot, is that education. So one of the things, this is pre-COVID, but even in fact post-COVID, what I will be saying to the government of India, different states, is that it's even more important that you accelerate the support, the training on skills. When I say education, I mean education in a broad sense, right? Skills, training, to provide women in particular focused, targeted opportunities and training programs at the rural level, at the rural village level, going there. And that is, that seems to me, so one of the things is that, you can't force people to give you business, right? You got to incentivize it. And the way you incentivize people is that it's the market mechanism is going to be in operation. And the power in the market comes from education, training, skills. So the state can really address the issue of gender inequality at a social level. This is social stuff. This is, you're taking me slightly outside the economic frame, but in terms of addressing gender inequality that exists in many parts of the world, and rural India and urban India to some extent as well, I would say education in the broader sense. You give them, using one of my areas of expertise is bargaining, negotiations. You give them bargaining power. And you give them bargaining power by giving them education to say, I'm out. Where are you going to go? I have skills. I can set up business. I can get a job. And that is the way to do it, not by giving them, money. I think that's, you might want to do that initially anyway, but that's what I would focus on. And I think the pandemic, I haven't seen the data on this, but Parul, if the pandemic has shown that women have suffered disproportionately more, I would say, as a policymaker, economist advising the Prime Minister, you need to spend disproportionately more on training programs targeting women. So I need to see the numbers on that, which I haven't. But if that's the case, that's what you do. Education is, it's not a panacea, but it is the sustaining way to sustain addressing this gender issue.
Thank you so much. Thank you.
Back to you, Chitra.
Thanks a lot, Dr. Muthoo. We have questions just pouring in. We have another question from one of our colleagues at JGBS, Sunil Matthew. Sunil asks, my question assumes that the lockdown and its effects were primarily an urban phenomenon. Considering the limited rural effects, which is anecdotal or personal observation, where the rural effects were stopgap. So considering the limited rural effects, where stopgap fiscal policy and monetary policy decisions really beneficial? Would policy in the form of direct transfers make sense for urban poor, assuming the demonetization experience resulted in deeper penetration of banking in India? Could you please share some insights about the rural impacts of COVID-19 in the UK?
In the UK. Sunil, thanks a lot. That's an interesting question. You put the Indian context, and then you asked me about the English context. But let me, so this is absolutely that. Again, I haven't seen the data on the Indian context, but I'm sure you're not saying that the rural populations in India haven't been affected. They would have been affected by the fact that economic activity, they're trying to sell stuff, is not being bought, for example. So rural communities in India will have been affected, I'm sure, by the lockdown measures, by the shutting down of the economy, and that's why, in some sense, that's why government support to the rural community, the people who have lost or lost their livelihoods, in the form, again, there was a debate around whether direct transfers or otherwise. Again, it depends whether they can access markets. If they can't, then you need to have, then it's not cash transfers, then don't work. What's the point of giving them money into their bank accounts? You need to provide food to them. And again, that will have happened then. I don't know. So now that the Indian economy is not in lockdown, is whether activity has picked up in the rural communities. For example, one of the biggest sources, one source of income for rural community is through the migrant workers. So again, have the migrant workers come back? And I think Parul's earlier question suggested maybe not, still happening. It's not happened yet, and therefore that'll impact indirectly the income flow coming to the rural communities. Is the fact that the informal economy in the urban sector has been adversely impacted. I mean, one of the things, again, the economy, even in India, the rural urban is connected, deeply connected, and therefore, so even though might be no monitoring of lockdowns in a village of 1,000 people, they are impacted indirectly by the lockdown. In a similar way, by the way, of course, in England, much smaller population, equal to one state of India, 70 million people. The rural communities were affected again differentially than urban communities. For example, people who are living in rural villages in England, didn't have to. They might have been working locally. While as someone working in London, a big city, is affected differently. But the support measures, unlike again, the difference compared to India was that, in England, whether you're in the rural or in the urban, you're on the system. It's a smaller population to manage, you're a richer economy, and therefore you're treated symmetrically. So here, there's a symmetric treatment. That said, Sunil, that said, one of the big debates happening right now is that, in the rural areas, especially in the beyond the north of England, and there's not enough infrastructure compared to the south, and that has that adversely affects those communities in a pandemic. So, for example, what happened, what's been happening last few months is that Manchester, Liverpool, the north of England have been adversely affected more by some of these restrictions than the south. And you could argue that it's not a rural-urban divide that might be that will be the case, let's say, in India. Here it's a north-south divide. So there are differences there. I'm not sure I've answered your question well enough, but hopefully one or two things I've said might help you to think more. But feel free to come back.
So, Dr. Muthoo, I have a question. You have been talking about cash transfer and its efficacies. So we have heard from many economists who have been talking about, who have been advocating, very vocal advocates of a cash transfer, conditional or unconditional. We all know that good economics doesn't always make for good politics. So
tell me about it.
So very recently, then one of the states in India, West Bengal, the state where I belong to, the West Bengal state government, they have come up with a plan. It actually, it's called, it's a health card, that provides, that's an unconditional health card. So anyone who applies for the card, they'll be eligible for that card. So it gives, every person holding that health card, a coverage of 5 lakh rupees of health coverage, and all the premiums are borne by the government, right? So do you think that instead of transferring cash to people's bank account, things like this, if they are of course implemented rightly, implemented properly, it will help people in some way? I mean, because health expenditure is pretty,
yes. So I'm not surprised that the government of West Bengal have done that. So one of the things I would say is that we economists don't know what the right policies are, to be frank, because they're pros and cons. And also in this context, we need to work out any unintended consequences. Okay, so I just want to make the point to colleagues and students that we need to, one of the things the economists are good at, they try to work out unintended consequences of any new measure before they recommend a measure. And in this context, of course, we have studied the differential impacts of direct cash transfers, these kind of mechanisms that you mentioned, which are payment in kind through different kind of restrictions. One of the, I think the bigger picture that, and I think your Panar Bardhan was talking about it, is whether, one of the big things is whether the state needs to provide more support than they have before. I think that's the big question. People talk about it in terms of, UBI, a universal basic income. People talk about it in terms of something a bit less, a guaranteed basic income. And of course, in India, there are different kinds of social support. Ration cards, you know, when I used to live in India, ration cards were a big thing, and I'm sure they are still there. So it is thinking, the big question really is whether the government of India and the state of India can provide more support because of the pandemic for the next 10 years, let's say, not just next few months, to people. And you might take a view and say, I'm going to provide that. So that's the big question that needs to be addressed. And then you ask the question, well, how do you do it most effectively? In terms of whether you do it through the health card is one possible measure. And sometimes, you know, one of the things I would say is that it may be that once we agree, we need, and that's what's been agreed by in the UK, they're saying no austerity, we're going to pump in money. And that's what the government of India needs to agree, that we're going to borrow more. I don't know what the latest is in terms of how much debt we have in India. In England, I think it's about 130% of GDP. It's gone out of the roof. And my view is let it go to 200% even of GDP that you have, that the state has debt. If the government of India is willing to do that, and I think I would be advocating, I don't know if the Prime Minister Modi is listening to me right now, but I would say, go for it. Go for it. You know, these are unprecedented times. They call for unprecedented policies. India's economy is worth about $2 trillion US, something like that. Borrow that much, let the debt go to 2 trillion, and then you spend it. I would say a number of measures. It won't just be the health card. The health card scheme sounds like a good idea. You focus around the supporting people's health, especially in the next coming time. And of course, we know, you know, I made the point early on to Parul that about education being key. Equally important is health. We know the two key important things is sorting out health and sorting out health, education. The rest, I was going to say the market will sort out, but the rest people will sort out. You know, if my health is good and I'm educated, I can do my stuff. And that is the problem. So the state needs to intervene big time in providing people with good health and therefore access to health services. Access is a big problem, by the way. You know, one of the problems in India is access. You know, where's the nearest hospital to the villages in the middle of MP or middle of West Bengal? And that's where the state needs to think about. And I know those are hard questions to address. So Chitrakalpa, I think it's not a bad idea, but you know, I would invite you to think about the bigger picture. You know, what do you know what is the latest in terms of how much debt India has, government of India has? When you, by the you're on mute, but when you go, so I'm, you know, here's a number, leaving everyone with this. England is around, I think the UK government has about 120%, his debt is equal to 120% of GDP. I don't know what the Indian debt is in terms of a percentage of GDP. I would say that as an economist, I'm not being frivolous. You can put it out the economists, and I would say in these times, something like, even if it goes up to 150, 200% of GDP that your debt is, you're fine. You won't explode. The reason why you got to maintain credibility with the markets and so on, but governments in the past have kept tight for various reasons. You know, we have to, these are the kind, I don't know whether these, I'm not in India and therefore not hearing what discussions are happening. I would be saying these are unprecedented times, relax the rules in a reasonable way. I don't know whether that discussion is happening at the central bank level, at the state level, but that is discussion. This is not the time to say, I'm going to keep the money in the pocket. So I don't know, is that kind of discussion happening in India?
Well, yes, actually. I mean, I was just looking up the numbers. So India's external debt right now is about $555 billion. That's about 22% of its GDP. So yeah, I mean, Indian government does have a lot of.
Listen, send this video to the Prime Minister. Tell him that a little economist from England is saying double, triple borrowing.
Yeah.
Print, borrow, and India can afford. India has. See, one of the things, international money markets, when they look at India, is huge amount of amazing talent. India has amazing talent, young, and many of them are young demographically. India has huge potential because of human capital. And for that reason, you know, I think Apple is moving its production there. It can be a magnet. And therefore, you know, If it's only 25% for crying out loud, let's double and triple, and let's use that money to do the health cards across the nation, to do the training programs for the women. This is what needs to happen in India. And the Prime Minister Modi should not be afraid about it, should not shy from spending on that. Anyway, back to you. Are we done?
And you have actually answered in quite a few questions that that the participants have been asking here. So they've been asking, how do you think the Indian government has tackled the pandemic so far, or what are the other things they should do? What are the different unconventional policies that they should bring in? So and you have already partially answered this question. So coming to this, one student have asked, Mandira has asked, do you think the fiscal and monetary policies should be altered and more unconventional policies should be implemented to increase economic resiliency for the future?
So Mandira, I would say, I think what I just heard, if Chitrakalpa got this right, that Indian debt is only 30% of GDP, this is not good. I don't know who's advising the Prime Minister. This is a time where you need to spend, and you're borrowing against the future. Absolutely. When are you going to do it? It's raining like anything right now. And I think that is the big picture. Once you decide to open up, to relax the fiscal rules, relax the monetary rules, once you decide to take that approach, the policies, the specific policies, how you do it is easy peasy. It's countries trying to fix the problem, fix the roof with 10 rupees ain't gonna happen. It's just going to be more suffering. And it's, the funny bit is that once you do that, you will see, if you think about how do economies prosper? Economies prosper when people have confidence. Okay, when businesses have confidence, when they see the government spending on infrastructure, on supporting people becoming healthy and therefore more productive, they will say, fine, I'll open my business now because people are going to come and spend stuff. So I think that is what governments and politicians need to do. By the way, you made the point earlier on about politics being more important than economics. Absolutely. It's about politics is center stage for the next 20, 25 years, because it's going to be governments who are going to be making decisions. Of course, they take advice from scientists, from whatever, from economists and so on. But it's about political vision. It's about being brave, and it's going to be, what the world and India and other countries need is more and more of visionary leaders. It's a bit like, it's like what happened, 100 years ago, So it is, in some sense, intellectually, it's an exciting time to think big, think about the specifics of the policy. UBI, there are pros and cons. UBI would cost a lot. Just imagine if you have a certain decent level of income and you give it to every single Indian. That's a lot of money. That's going to be more. That's going to be like 200% of GDP, maybe not 200, maybe 40%, 50% of GDP, and that's a lot of money. So maybe they can't afford. India can't. No, many countries can't afford to provide a UBI. I think it's about 35% of a reasonable amount of UBI would be about 35% of the GDP of a country, which is a state just spending on UBI. That, of course, you would save other transfers, but it's something to be studied more. The notion of a UBI, but in the meanwhile, you can spend on lots of other measures. Things. I don't know whether things are getting better over the last month. Difficult. I guess I was going to ask you a question. Do you? Hopefully, you're not locked in your room all the time, but you're going out and singing in your right. I think. Are you hearing? Are things getting better? What's the mood music like in India?
Well, when it started in March, April, May, when the numbers were really small, people are much more scared. And for example, I live in Delhi, and Delhi has survived 3 waves of infection. Each wave bigger than the previous one. And right now, some sort of a complacency has set in. People are going out and about their daily lives. They're going to the stores. They're thronging in the malls. They're going out and eating in the open air cafes. So things are starting to come back to normal. But it's not yet still normal. People are still falling sick. Until a couple of weeks back, Delhi had about 6,000 infections per day, but the government has intervened and it has now come down to around 2,000. It's still a lot, but it's going down. So and overall in the country, the way I see it from the data, we have reached the peak sometimes in September. So we have reached around 100,000 a day, and right now that number has come down to around 35,000 a day. So things are looking up. So let's hope.
And the death rate in India was much low than
Much
elsewhere.
much
And
lower.
again, because people argue because of demographics. So India is a very young population compared to, let's say, Europe.
Yes, one thing is that. Another thing that the people argue is, and there are certainly lots of theories are floating in, that Indians get this BCG vaccine when they're young, which is I think it's
What's BCG?
BCG is, I think, can somebody help me what BCG
What's
vaccine?
BCG? Is it those? I think I had it. Is it those kind of which leaves big marks?
Which leaves a mark, brown.
Oh, big marks. I have that. I got them done as well. Yeah, I
Yeah.
got them.
So apparently, there is some theory floating in that people who have got BCG vaccine, they have some sort of added immunity against the virus. Of course, some people say that I mean, because Indians, the living conditions is very much different from other countries, so we are automatically immune to a lot of diseases, and which includes COVID as well. So yes, death rate has been significantly low. This has been one of the good things. But still, if you look at the total number of people who have passed away from the infection, that number is still stays pretty high.
Okay, good. I think it's time up. I think time is up.
Do you have time to take one more question?
Yeah, sure. Go ahead.
I'll just take just one more question. There are lots of questions. There are like 30 questions.
By the way, can I just say, I know I'm really sorry that one thing I was going to say before I take that question is, I've really enjoyed the questions you have sent me, you gave me. It's been fun interacting. I always a lot of energy, and I can see now 29 questions. Absolutely, feel free to email me, students, faculty. Feel free to email me, and I will engage. So just want to say that I'm not. So this is not. If you want to email about something, feel free to email. I'm very happy to continue a conversation in that way.
Sure, and all the questions that remains unanswered, I will collect and I'll send it over.
Okay.
Yeah. So Sunil has written here is that BCG or Bacille calmette guerin is a vaccine for tuberculosis. So it's the same respiratory.
So he's saying. So you think I want to look it up. You think that provides some immunity against coronavirus?
Some theories was floating in. I don't know the veracity of it, but some people have been saying that this might be one of the reasons.
And is it something that we Indians get given at birth, around birth time?
Yes, it's one of the the few vaccines that the
yeah. That's interesting. I might Google this. I didn't know. That's interesting. I think I may have had. Is it the one which leaves big marks?
Yeah. This leaves a big round mark. Yeah.
Yeah. Maybe I had it anyway. So, question.
So I'll just ask you the last question. That's from one of our PhD students, Shalika Rakesh, and Shalika asks a very interesting question. It's about if the pandemic is going to change the pattern of migration, pattern of rural urban south north migration. When the pandemic happened, and we have seen the plight of the migrant workers, they still consider that the COVID-19 is essentially an urban disease. Well, the way it came from outside, so it started from urban areas. Now, lots of people in the rural areas, they have said during that time, and who have come back to their home villages, and some of them, they're still saying that we're not going back to the cities. We will stay back in the villages, and we'll find some work to do here. So what Shalika asks is that, do you think that this is going to have some sort of an impact on the labor market post-pandemic, when not all our migrant workers might be back on job in big cities in Delhi and Mumbai?
Shalika, thanks. Great question about this migration issue. So one of the things about human beings, if you look at the human history, these things have happened every so often. Okay, in different parts of the world. We talk about Spanish flu. So one thing I'm clear about looking at human history, and you should be as well, is that initially human beings get scared and we will do what you're hearing, stay in our homes, not going back to the city. But most human beings will start going out. Okay, so first of all, migration, travel is going to happen. Now, it might take time as we're less scared. We're going to travel. You're going to travel. I'm going to travel. I'm going to come to India. You're going to come to England, right? That's going to happen. It might not happen straight away, but in due course it'll happen. And similarly, within migration, people will go where there are opportunities, right? So that I want to say clearly, it's not when the world's going to change in some dramatic way that people are going to be now not traveling. There'll be migration or even working other places will stop completely. What might happen as a result of the pandemic is there might be some change in the labor market. Now, this is the second part of your question. Is the labor market going to be affected? I think it will, because one specific thing is that, I hate Zoom. I like one-to-one face-to-face. I like interaction in person. You cannot replace that ever, until Elon Musk succeeds in 100 years making us all robots, in which case, well, that's human beings gone then. But until human beings exist and we have emotions, we will want to interact in person, and therefore, but at the same time, the Zoom has brought something positive. As I said to you, we could start doing stuff on Zoom. We could have that meeting on Zoom rather than in person. So the labor market will, so the impact of the pandemic through things like technologies like Zoom will mean that the companies may not have people needing to come every day to office. It may be the contract, especially young people. Shalika, maybe you, when you go, I don't know what your plans are, whether to stay in university afterwards or go into the real world. The contract you might say, hey, the contract says flexible working. So what you might have is the labor market, how people work might change. The contract might change. So you only have to come in twice a week. Or 3 times a week, and that's by contract. Before, academics used to say, "I'm not coming in today," but sort of with their heads down. But this might be now much more open. How businesses are done, right? New kinds of businesses might, because more businesses are coming online, it might affect more people working from home, more gig economy. So the labor market is impacted by the nature of work. So indeed, the future of work and how we work is going to be disrupted by the technologies anyway, by AI technologies, accelerated by the pandemic. So that is going to happen. As to what, I don't exactly know. I think no one exactly knows. I'm giving some pointers. It's an interesting topic to research, to read about and think about. But I would say that definitely over the next 10 years, people will be going back to the informal market in Mumbai, in Delhi. You will see the migrant workers coming back to the cities, because it's not as suddenly there's going to be opportunities in the villages. Okay. So Shalika, it's not suddenly the government's going to say, right, businesses and firms are going to say, let's set up shop in the villages now. That ain't going to happen suddenly. You might have some, so there's going to be a shift. I mean, it's a bit like thinking about inequilibriums. Basically, the equilibrium has been disrupted. We are going to go to a new equilibrium. That's clear. However, that new equilibrium will have a lot of similarities and a lot of same things as the old equilibrium. Okay, it's not a completely different kind of thing. I think it's a funny thing that the way to think about the disruption, the change, the new normal, is to think about the changes that were happening anyway are accelerated. So that's I think that it is. Things that people were taking 10 years to do might happen tomorrow. UBI might have taken 50 years to happen, might happen in 10 years. So I think that's one suggestion I would give is look back. What were the topics on the agenda? What sort of technologies were people talking about? Climate change, for example, has accelerated the agenda to do more about emissions. So maybe, we're going to, in England, by the way, just to give you an example, Shalika, in England, and which will disrupt labor markets as well, is that the Prime Minister announced, I think a couple of weeks ago, that from 2030 onwards, there'll be no sale of a petrol or diesel car. What, in 10 years time, I can only buy a new electric car. but that's going to impact on business. That's going to impact on the labor market, because I can tell my boss, look, I don't have an electric car, I can't afford an electric car until it becomes cheaper. So I think what I'm saying is that just look at where technology is. So the answer always this century is in technology. What's happening with technological change? Thank you. I hope again, I'm really apologize. I don't have answers that you can say, but that's you don't want that. You don't want ready-made answers off the shelf and say this is it. No, you want to sort of think for yourself and do it by yourself. Anyway, so leave it there.
Thank you so much, Dr. Muthoo, for patiently answering the question. We have so many other questions, and this is and you spoke so well, and it has been such a great lecture, and the questions are just coming in, and the students are texting me some questions on my cell phone as well. Of course, and one other thing that we have seen, this is probably one of the opportunities that this pandemic has presented to us, is we can have you. You're sitting in the UK. You are delivering a lecture here in India. Literally, the classrooms are now without boundaries, right? So, I mean, probably, I don't know. I mean, this is going to be a good disruption, and I hope that it stays. I mean, the Zoom and all this stuff. We never really bothered about this even like a year back. I haven't even heard about Zoom in before March.
Neither did I.
But then again, this is all we do all day nowadays.
So you're right. I think this will stay. So I'd rather come to India and come to the campus and give a lecture in front of the students and staff. But you're right. You can also do a mix. You can have it. You can have some which do it online from the US, especially, and some who do it in person.
Absolutely. I mean, for example, having a 1 day or 2 day conference in the university, in a pre-pandemic time, it's very expensive, right? So you have to, if you are looking for, getting good people, like keynote speakers, you have to fly them in. But now, I mean, you can do it almost in a costless way. That is something really really good. I hope that it stays. So thank you, Dr. Muthoo, so much for coming here and delivering the lecture. And all of us, we absolutely loved your talk. And we all hope that when the situation normals, when this pandemic is over, then we'll have the good fortune to host you in campus, in person, and maybe you can spend some time with us, with our students. We can have interactions, and you can catch up in person.
With pleasure, absolutely. I'm supposed to come to India in June.
Oh, great!
I have some collaboration with this and that, and I normally come to Delhi, but I'm originally from Srinagar.
Okay.
But I don't go there anymore for now 30 years because of I think last time I was there was 1989 when I was a teenager, and my grandmother, and then the war broke out, the Civil War broke out in '89. And now when I come to India, I now go to Delhi. North Indians. I don't know how many of you are North Indians, but basically North Indians hang out in North India. It's funny. I've been to Mumbai a couple of times, but I know the rest of India is much more beautiful, I think. But anyway, so basically, absolutely, I come to India at least once or twice a year. I was supposed to go this year, cancelled it. And I tend to go to Delhi. I have certain projects in Delhi. And definitely, I know you're in Sonipat, right?
We're in Sonipat, yes.
Yeah, so no, real pleasure. It would be a pleasure to come and see you all in person when possible. Absolutely.
So if you visit Delhi in June, please let us know.
No, I will.
And we'll make sure that you can have it in the campus.
Hopefully, again, I think it depends on. So hopefully, I'm hoping that by June, definitely Europe should be seeing some normality because the vaccine is being rolled out. We'll see what the travel is to Delhi and what the situation numbers are in Delhi. If I feel safe and you guys are on campus now, back on campus around that time, absolutely, we'll stay in touch and I can come and visit. Thank you, everyone. Thank you very much for the questions. Thank you for inviting me. Great. I really enjoyed it as well.
While we have been talking, so I just got this pop up on my phone that in the US, the Pfizer's vaccine has just been
approved.
Right, so they'll probably start shipping it by the end of this weekend. So that's some good news coming from all over the world. So let's see. Thank you everyone for joining us today. Thank you the students, thank you, the faculty members for joining us. It has been a great semester. So we have had some great lectures throughout the semester. And thank you everyone for joining in these lectures and making this series a success. So today is the last lecture, and it brings a closure to the Inspiration Lecture Series of fall 2020. We will start once again. We have already started working on it. We have some very exciting speakers in line for a spring 2021 installment of Inspiration Lecture Series. So it's adieu from our end, adieu from Center for Research in Economics, Emerging Economies, and we'll see you all next semester. Thank you very much, and you have a great time ahead.
Chitrakalpa, stay safe, stay well, everyone, and hopefully I'll see you when this will all be behind us.
We hope.
Thanks a lot. Take care.
Thank you. Thank you.
All the best.